Welcome to In Focus on this Sunday, June 29th, 2025. I'm Cheryl Wills. New York City, home to nearly 8.5 million people, but the most populated city in America, does not have enough hospitals or medical facilities to serve its residents. More than 30 hospitals have closed throughout New York State over the last 30 years, according to the New York State Nurses Association. The latest, Beth Israel in the East Village, closed in April, despite a fierce fight from the community to save it. And that's not all. You may remember two beloved Catholic hospitals went under in Manhattan years ago. Cabrini Medical Center shut down in 2008, and 2 years after that, St. Vincent's locked its doors. Brooklyn's Long Island College Hospital closed in 2014, and Queens has been devastated with back-to-back losses of medical facilities. You may remember Mary Immaculate in Jamaica, gone in 2005. Parkway Hospital in Forest Hills, shuttered in 2008. We lost St. John's Queens Hospital in Elmhurst back in 2009. And in 2012, Peninsula Hospital in Rockaway Beach, gone. Our guests on this Sunday, Queensborough President Donovan Richards. Find out why he's now excited about the construction of the borough's first standalone cancer center at Jamaica Hospital. Plus, the leadership of St. John's Episcopal Hospital is with us. They're the last hospital standing in the Rockaways. We'll tell you how they made it through the pandemic. All that and so much more happening now on In Focus. Let's begin today's conversation with Queensborough President Donovan Richards. Always great to have you here.
Always good to see you, Cheryl.
So Queens, the largest borough in New York City in terms of population, there are not nearly enough medical facilities to accommodate nearly 2.5 million residents. I know it's 2.4 million. How did we get here, Mr. Borough President?
Well, we got here because under prior administrations at the state level, we saw a lot of hospital closures, and we felt that impact, especially during COVID-19, where we were underbedded and we had our hospitals busting at the seams. So really what we're looking to do is to address that with a multifaceted strategy, which is to make sure we can expand where we can on current properties, and then to look at other ways to strategically build out new hospitals where we can.
And speaking of building out, give us an update on the construction of Queens's first standalone cancer center at Jamaica Hospital.
Yes, and I really want to thank Governor Hochul. You know, my grandmother, I remember having to travel to Sloan Kettering in Manhattan, 2.5 hours one way by public transportation when she had cancer. And we wanted to make sure we address that specifically, especially for Black and brown communities who are disproportionately impacted by cancer. You should not have to leave your community, and it should not be based on your socioeconomic or zip code on whether you have access to a quality standalone cancer hospital. So we approached the governor and we were happy to secure a $180 million grant along with my colleagues, and we will be tearing down what was formerly known as a nursing home to now convert into a standalone cancer center, which will be in partnership with Sloan Kettering, which will actually service every type of cancer that you can. So I'm very happy about where we're going to go.
That's a big plus. And let's talk about the groundbreaking of a $30 million health clinic in Rockaway Village.
Yeah, and you know, we've seen a lot of health disparities. You know, in Rockaway, 1 in 10 individuals have diabetes, 1 or 2. So it's really about trying to do as much as we can to provide more preventative care. We have St. John's Hospital, the one and only hospital on the peninsula, who's doing great work with the growth happening in the Rockaways, a projected 10,000 units. We need to make sure that residents of the Rockaways don't have to leave to get quality care. So this clinic is going to offer us every different type of service you could think of, from dental to mammograms to everything, to ensure that residents don't have to leave the peninsula to seek quality care.
Yeah, you know, we have St. John's Episcopal Hospital on in the next segment, and they've been doing a Herculean job, especially since the pandemic, after Peninsula Hospital closed. What's your message to residents in the Rockaways who say, what's happening here? We lost Peninsula, and there's only one hospital that's shouldering the weight for the entire peninsula.
Well, one, it's about making sure that we can keep people out of the emergency room, right? And part of that strategy, we talked about the H&H. We just opened up and expanded the Adabo Health Center, something I started when I was in the city council, which is going to provide thousands of more opportunities to provide that sort of care, especially for women and children, our most vulnerable populations. And then St. John's is doing a granular job at ensuring that they can service the entire community. And listen, this is a national problem. We've seen hospitals in Brooklyn that were slated for closure. We saw hospitals out in Manhattan. So really what we're trying to do is make sure wherever we can strategically invest. For instance, we're looking at a women's health center, which the governor provided us with $50 million for at Elmhurst Hospital. So we have to be creative. And this is a call to action, right? We need the state to really focus in on expanding the services, building new hospitals. And with this with Donald Trump administration in office, it's going to really be difficult in the days to come with some of the cuts that they're seeking as well. So our hospitals are really holding on by bare bones, and we're going to need to do everything we can to support them from a state and city level.
Yeah, and most importantly, in the Rockaway area, they need a level 1 trauma center. And I know there's a task force that is working on that. Do you know of any updates? Well,
I think that there are some challenges with that, but I will give a lot of kudos to Councilmember Sylvina Brooks Powers, who's identified some specific sites. And, you know, to reach a level 1, you have to have a certain amount of incidents. Unfortunately, we don't meet that threshold for a level 1. So the conversation has sort of turned to level 2 and level 3, and that work is ongoing.
Okay, well, you know, thanks for the update. I've always wanted to have you here to talk about that very issue, because what's happening on the Rockaways, it's pretty serious, and that's why we have St. John's on in the next segment.
And I just wanted to add also, at St. John's, you know, we are now, because a lot of women have to leave the peninsula to give birth, and I've put a substantial amount of money into making sure we can build out a new maternity ward. You should not have to leave your community to give birth. We know that Black women especially suffer disproportionately when it comes to that, especially among deaths among children. So this is really going to give us an opportunity at St. John's to correct those disparities. And really, you shouldn't have to leave your community to deliver a baby.
Yeah, and we're going to amplify their new birthing center. Is really phenomenal. It's beautiful. I saw it. Thank you for being here. Queensboro President Donovan Richards, thanks for your time. And still to come, a look back at when Peninsula Hospital was pulled off life support for good, leaving just one hospital for the Rockaways. Like we said, St. John's Episcopal. We'll talk with the CEO of that hospital on the other side of the break. Thanks for staying with us. Joining us now is Dr. Donald Morrish, CEO of Episcopal Health Services, and Dr. Jacqueline Marichaux, chair of the newly expanded Labor and Delivery Suite at St. John's Episcopal Hospital in Far Rockaway. Thanks to both of you for being here.
Great. Thanks for having us.
Absolutely. Dr. Morrish, I want to start with you. After Peninsula Hospital closed in 2012, St. John's Episcopal became the only full-service hospital serving the people of the Rockaways, population about 125,000 people, give or take. Then the ultimate test came with the pandemic. How did you manage?
Yeah, it was a very interesting and challenging time for us. With 18 skilled nursing facilities on the peninsula itself and over 120,000 people to take care of. It was certainly a challenging time. I've got to give a lot of kudos to our staff who've done a great job in leading the medical forefront of care in COVID, our doctors, our nurses, our ancillary staff, and also having support by local elected officials and state officials who really supported us financially through it. We got together as a team and served the community as we should have, and very very proud of their effort in taking care of the Rockaways.
Yeah, job well done, that's for sure. Dr. Marichal, you were among the team as the chair of the Labor and Delivery Suite. You are now taking it to the next level. Tell us about this new suite you're so proud of.
Oh my God, I believe and I'm enamored by the partnership that I have with Don to my right. He has been a champion for me, put me in this position to bring this unit forward to our community. For us, it's a love letter to the Rockaway community. It's a sanctuary space. It's you can look outside and take a look at the view and look at the breathtaking beach of the Rockaway Peninsula. From our spa-like bathrooms to our UV light inspired cesarean delivery suites, it's something of a wonder. We did something not short of a miracle to bring this space to fruition.
Yeah, it's never easy to do it, but you got it done. Dr. Morris, your hospital has received several national re-accreditations for baby care, for advanced stroke. Tell us more about that.
It's really important for us to be committed to high quality care on the peninsula itself. The team is really committed to getting Joint Commission accreditation for stroke, also taking care of patients in the obstetrical units itself. Being the only healthcare facility really on the peninsula on the inpatient side, we have a tremendous responsibility to do so, and the team shows up every day to make sure that we understand what our community needs and what we can provide to them. So we're super proud of what we're doing in the ambulatory space as well as in the inpatient space itself.
That's great. And Dr. Marichal, many of the moms in your new unit come from low-income neighborhoods. You well know, of course, about the maternal mortality rates are sky high in this city and this state. Under your leadership, how do you make sure moms get the care they need?
Well, this particular space is birth equity that meets reality. It is, a space where women and children bring families to an organization, and we take first stab at trying to have this space decrease the maternal mortality and mitigate all of those disparities.
Yeah, so you're sensitive to the crisis that's happening.
Absolutely,
Yeah.
and I have my own personal story whereby, postpartum I delivered preeclampsia as well as postpartum depression. And so I think for me, it's a personal journey, it's a personal experience, and I lend this towards our patient population. And for them to be able to see me as that person that experienced these things, then they can see someone real, and I think that is the message that we want to send home here at EHS.
That's great. And Dr. Morris, you've worked with the hospital since 2013. You are also OBGYN, right?
Yes.
And tell us, what makes St. John's special, and why are you proud to lead this hospital?
I'm super proud to lead this hospital because of our commitment to the community itself. Being a member of the medical staff for 12 years, being an obstetrician and working alongside of Dr. Marichal, it's the level of commitment, making sure we give compassionate care that's respectful and empathetic, and addressing significant health concerns on the peninsula itself. And as our previous guest has said, that what it is, we're geographically isolated.
Right.
People should not have to go off the peninsula to get high quality care. And I'm super proud of Episcopal Health Services to provide such high quality care in the area itself.
Well, listen, high five to your staff. Most of my siblings, I'm the only one that wasn't born at St. John's. So high five for a job well done over the decades. And thank you for what you do, both of you. Thank you for being here as well. Dr. Donald Morris, CEO of St. John's Episcopal Hospital, and Dr. Jacqueline Marichal, chair of the Labor and Delivery Unit. Time for another break. In Focus continues right after this. And now, a flashback from our New York One archives. April 12th, 2012, 13 years ago. Peninsula General Hospital is pulled off life support in the Rockaways. Locals did everything in their power to stop the closure of the medical facility, which opened on April 30th, 1911.
My baby's sick and I come here for care and they telling me it's nothing they could do because no pediatrician is here. It's crazy. Now what's gonna happen to, people in the community?
During the mid-20th century, Peninsula General became the heartbeat of Edgemere as public and private housing developments grew around Beach Channel Drive.
We're concerned about our ability to deliver quality health care. We're concerned about people's safety.
During the early 2000s, the hospital itself became sick. Its clinical lab shut down by the state health department. And on top of financial problems and a troubling reputation, Peninsula Hospital could not be resuscitated. Today, the Rockaways, home to some 130,000 residents, does not have a Level 1 trauma center. The Far Rockaway Healthcare Access Task Force, formed 3 years ago, hopes to one day change that because a report found that beachfront residents are forced to leave the peninsula to get life-saving care. By the way, the old hospital is now a nursing and rehabilitation center. Hey, thanks for staying with us as we talk about healthcare access in Queens. Joining us now is Tony Subraj, board member of the George Subraj Foundation, and Salia Atif, program manager at Northwell Center for Global Health. Thanks to both of you for being here.
Thank you for having us.
Tony, I want to start with you. I want you to tell us more about your personal story. Your father helped pioneer Guyana's first kidney transplant, great man, and he helped introduce pediatric heart surgeries as well.
Yes, you know, it's an interesting story. I have to give you a little history
Yeah.
here. Back in 2008, Guyana was facing a health crisis. Kidney patients were dying of renal disease, and my father refused to stand for that. He put together a surgical team from Walter Reed Medical Center and took them to Guyana and had the first live kidney transplant in Guyana. One surgery became hundreds. This led to national legislation and empowered Guyanese doctors to become transplant leaders, creating a sustainable healthcare system empowered by local care.
Wow. And now you're taking it to the next level.
Yeah, this heart care initiative is the next chapter to
Right.
that. We're trying to continue his legacy.
That's great. And Salia, heart disease is a major issue. 70% of Guyana's nationals deal with that illness. And you are trying, your Northwell is helping Guyanese patients, especially in Queens, right?
Yeah, that's correct. As you know, cardiovascular disease is the leading cause of death in Guyana. And unfortunately, without early intervention and specialized screening, it's extremely critical to provide that access to care. So through the George Subraj Family Foundation, we're really excited to address those critical gaps in care through a long-term and integrated approach through Little Guyana right here in Queens and also back home in Guyana as well.
Yeah, so it's a win-win.
Yes,
both
absolutely.
in Queens and Guyana. And thanks to you, Tony, tell us about this $1 million donation, the first of its kind.
Yeah, it's great. It creates a health bridge between Guyana and Queens. You know, there's such a need for cardiac care and bringing knowledge to the people back home and here. And through the partnership with Northwell, we're able to do that. We will be holding mobile screenings, healthcare clinics, nutritional workshops back in the neighborhoods that really need them.
Yeah, and the neighborhoods are in Queens, Salia. Explain, as a hospital employee with boots on the ground here, how this donation will help patients in Queens.
Yeah, so this will allow us to launch critical programming in Queens, as you mentioned, primarily targeting cardiovascular risk disease factors, so tobacco cessation and diabetes prevention program, which is very prevalent in the Guyanese population, so a customized program and an approach. We're also really excited to have this programming tailored to Guyana back home, where we will be training local Guyanese physicians and training them into cardiac subspecialty care. So it's not just about a one-time approach, it's really about motivating the future generation of Guyana healthcare leaders and putting cardiovascular care at the forefront.
Yeah, and do you notice the gap, because this whole show is about the gap in healthcare in Queens in particular. You notice that, of course, right? People come from far and wide just to get to Northwell.
Yeah, absolutely. Yeah. I mean, Northwell is very much so operational in Queens, and it is the most diverse county in the entire world. And a lot of our core team member population is also from the Guyana population as well. So it just makes sense to have this type of partnership, and we're so thrilled to be working with the George Subraj Family Foundation to raise health.
Yeah, and how did you identify this need? What did it for you that caused this $1 million donation to happen?
Unfortunately, my father passed away from cardiac disease. And, the pain our family went through, it was just really unbearable. And we don't want any other family to experience that. And, cardiac disease is preventable. By empowering families with knowledge, they can protect their own health care.
Yeah, and I know your father would be proud of what's happening, right?
Yeah, honestly, we're continuing his legacy.
Yeah.
He created a legacy of helping people that he would never meet, creating the whole transplant program, and now we're doing that with healthcare, with our heart healthcare.
Sure.
And, promoting knowledge-based transfer to people who don't have it.
Well, congratulations on this donation. It's going to help a lot of people in Queens and throughout the whole city. Tony Subraj and Salia Atif, appreciate your time. And now our final focus. One last note about the Rockaways as we approach the 4th of July holiday. During the spring, there was talk of banning bicycles on the famous boardwalk between 73rd and 108th Streets this summer due to safety concerns. It gets pretty crowded with beachgoers, and some cyclists, especially those on e-bikes, fail to slow down. Well, we've learned that the proposed ban during peak hours has been scrapped, but cyclists are warned. Stay in the bike lane and slow down around the congested areas. We wish everyone a safe and enjoyable summer. Hey, thanks for watching In Focus. I'm Cheryl Wills. We appreciate you spending your Sunday with us. Thanks for watching our YouTube channel. To keep up with important issues impacting our communities and hear more conversations with the people who are shaping the future, subscribe to our channel. You can also download our app or find Spectrum News on your TV for balanced, in-depth political coverage and more. We'll see you there.